Guys, welcome back to my channel. So today it's going to be all about the falls and the Morse Fall Scale. So we will first talk about the fall scale. We will then go on to prevention of falls, and then we'll discuss what to do when your patient actually does fall. So basically, the Morse Fall Scale is a evidence-based practice tool that is utilized in most hospitals. It is a 6-factor score, and basically our scores of 0 to 45 are a low fall risk, and our scores of 45 plus are a high fall risk. So basically, the 6 factors that go into the score are history of falls, secondary diagnosis, ambulatory aid, IV therapy, gait, and mental status. This is used in the NCLEX, so make sure you study up on this. Many hospitals require a fall scale as part of their initial assessment and documentation. And like I said, it does utilize EBP or evidence-based practice. So with the history of falls, this can be it's usually taken within the last 3 months. So it's done within the last 3 months, but also you can take into account a patient fall that day, a patient fall before arrival, a patient fall a few days ago, a week ago, a month ago, as long as it's within that 3 months. For a secondary diagnosis, so on top of whatever the patient came in with, if they have a diagnosis of hypertension, diabetes, asthma, it could be any secondary diagnosis along with that primary. Third is ambulatory aid. So bed rest usually gets a 0 in the score. Then cane, walker gets, I believe, a 15. And then the last one is furniture, which gets the top score. After ambulatory aid, we have IV therapy. So if the patient has a line, or doesn't have a line, if they have a line, it's an automatic 20 points. If they do not have a line, they get 0. Gait, so this can be normal gait, impaired gait, or severely impaired gait, with severely impaired being the highest score. And last is mental status. So is the patient AN04, or is the patient not able to answer anything? That is either 0 or 15 for mental impairment. So basically, like I said before in the beginning of the video, score of 0 to 45 is low, and a score of 45 plus is high. Alright, thank you. Alright, so welcome back to our second part. This part is on prevention of falls. So basically, scores of 45 plus are a high fall risk. They will get our standard fall prevention. And now this depends on your facility, mind you. But it's bed lowest position, socks, wheels locked, and call bell within reach. Plus, because they are a high fall risk, say that 5 times fast, they will be getting a special fall bundle. This, again, depends on the hospital. Usually it's yellow, everything. They'll get yellow socks, a yellow fall band. They'll get a fall poster, usually some hospitals do. They get utilized the bed alarm, and they get moved closer to the nurse's station. Now, like I said before, you want to check your workplace policy for fall prevention, because it all differs depending on where you work. Not every place is the same, but most of them have the same basics in each. So this is the special fall bundle. Also, scores of 0 to 5, so no to low fall risk. They get the standard fall prevention, which was listed up above, but it's socks, bed at the lowest level, and the wheels locked again. Thank you. So the last part is what to do when your patient falls. This also depends on facility, but you should follow the same basic protocol. So, say your patient has a unwitnessed fall. Say you walk into the bathroom and they're just there on the ground. So first you want to assess your patient. You want to make sure that they you want to check for visible injuries. You want to check if they're appropriate, if they can answer you. You want to test their mental status. You're going to look for visible injuries. You're going to look for bruising. You're going to look for scrapes. You're going to look for broken bones, so be it, if there is one. You're going to keep a lookout for that kind of stuff. If there isn't, you should definitely still advocate for your patient. You want to get help from your colleagues. You want to let the charge nurse know. You want to make the doctor aware. Before you even get the patient up, you're going to check their blood sugar and you're going to check their vitals, because hypotension or hypoglycemia can cause people to faint, pass out, so be it. Once you get the vitals, once you get the blood sugar, you're going to safely get the patient back to the bed. You can utilize wheelchair. You're going to need a lot of friends to help you with this, because you cannot do it alone. You will break your back, you will injure yourself. And then afterwards, you want to continually assess this patient more frequently, just due to they could have hit their head, they could have had an injury. You want to make sure that you continually assess this patient. That is key. But what you do depends on your facility as well. So make sure you read up when you first start as a nurse on your facility's fall prevention and fall policies. This is critical to your career. You want to make sure that you go back and you update your Morse Fall Scale that we did in the beginning of the video, because of the fall, it will change. Their gait can change, their mental status can change, IV therapy can change. That first fall question will be a yes. And more than likely, they're going to become a high fall risk from a low fall risk, or remain a high fall risk. But yeah.